Welcome back to the morning show on Tobago Updates. And of course, this morning we're speaking with Idi Stuart, the president of Trinidad and Tobago Regional Nurses Association. And of course, the call is for more nurses in our health facilities, right? Is Idi there? Good morning. Good morning,
Yes,
sir.
pleasant good morning to you and your listeners. Thanks for having me.
Thank you and welcome to the show. So, we're going to get straight into it. We're reading that, of course, the nursing staff is terribly understaffed. And that, of course, recently there was a protest demonstrating your dissatisfaction with the nursing population in terms of the ratio of nurses to patient care, right? And you've taken a
Yeah.
stand for that. And we just want to get a little update as to where that is, what was the cause of this, and what are some of your recommendations?
Okay, great. Thanks for having me once again. So, the Trinidad and Tobago Registered Nursing Association really is on a national drive to improve the quality of care to our citizens of Trinidad and Tobago. It's really our, even before, above and beyond being a trade union, which we would try to seek improve socioeconomic conditions for our members. We are a professional association who is seeking to improve the quality of healthcare within Trinidad and Tobago, and we're trying to do it from within as opposed to the top down mentality which we have grown accustomed to as a society, where the politicians or some permanent secretary directs or secretary for health would direct how they want the healthcare system to be operated. We are trying to do it because we are on the ground working 24/7. In fact, there's probably no other category of staff who is always present within our healthcare facility. Always, no matter what situation you have within the healthcare system, it's nursing personnel. In fact, nursing personnel comprise 50% of all healthcare workers. So one would generally think that if you are creating policies, if you are creating any sort of mechanism to move and propel healthcare forward, you would want nursing personnel to be present. Unfortunately, in Trinidad and Tobago, and to be honest, another number of other territories, internationally, regionally, there's just not enough nursing personnel within the system. And how certain territories has tried to counteract that is by implementing mandatory patient to staff ratios. Thereby, the institutions, those healthcare institutions, are now forced and they have something to work towards ensuring there are enough nursing personnel to properly and safely, and that's the key word, safely care for our beloved patients. What you have in Trinidad and Tobago is a situation where it matters not how many patients a nurse has to see about. They will keep bringing more and more patients, depend because, as you know, we have been feeling as a society in terms of healthcare. We are we focus primarily on sickness care. So we wait basically until you get sick and then begin to treat you. So it really has been overwhelming our healthcare facilities for quite some time. And you have a situation where, particularly in Trinidad and Tobago, in Trinidad, I should say, where you have sometimes one nurse seen about 14, 15,
Mhm,
20 patients at some points in time.
mhm,
And persons in Tobago would know that if it, even though the situation is not as dire in Tobago, it's still an issue because even when there are cases which cannot be handled in Tobago, they have to be transferred to Trinidad. That means the same low levels of patient to staff ratios which exists in Trinidad would affect those high priority cases which come from time to time um, transferred. So and the literature is clear. The best practice, the best opportunity for success of a patient to overcome their illness is to have a patient to staff ratio. For instance, in medical surgical wards, which is predominantly the largest volume of patients in those medical surgical wards, you would ought to have one nurse, one registered nurse to about 4 patients, max 5 patients. So that one nurse would see about 4 to 5 patients. So if you have a ward of 20 patients, you should really be seeing no less than 4 to 5 nursing posts, registered nursing. Now, there's other arms of nursing. There's the auxiliary and there's the supportive staff. So in Trinidad and Tobago, we have enrolled nursing assistants. Now, the enrolled nursing assistant is to assist the nurse. The enrolled nursing assistant cannot replace the registered nurse. Yeah, and then you have patient care assistants also to assist the enrolled nursing assistant and the registered nurse. They are not to replace. But what we are seeing is because we don't have enough registered nursing personnel, the government, successive governments, are trying to substitute the registered nurse with the assistants to the nurse, and that cannot be. It's actually illegal because those persons cannot fulfill some of the duties the nursing personnel, the registered nurse, because all of them are nursing personnel, cannot really substitute those avenues, and you end up with a situation where you have one nurse, particularly on the evening and night shifts, where you have one nurse trying to see about 10, 20 patients in some instances in some hospitals in Trinidad.
Yeah.
And no matter how we bring this information to the government, they seem not to listen. Because again, they are not nursing personnel, do not understand the gravity. They reject the evidence that is already out there in the international domain.
But
Yeah. Yeah, and I mean, you have spelled out a number of concerns there listed by yourself and your organization, and I'm guessing for you to reach to protest, you'd have actually had several discussions with the powers that be, and you are feeling that there's no relief to come for the registered nurses. I mean, tell us about the implications of not addressing this matter as soon as possible.
This matter is actually getting worse as we speak. It is getting worse daily. Reason being, we would have sequestered via the Freedom of Information Act the status of number of nursing personnel operating within every single regional health authority. And we did this since 2018 and we revisited it in 2022. So we have very up-to-date figures and we are actually requesting more information as we speak. And what we are seeing is that while there was a manpower shortage, nursing manpower shortage, identified by the Ministry of Health and the Division of Health of close to 3,000 nursing personnel back in 2018, when one would have thought that the ministry and the Secretary for Health and would be to address that short power, that manpower shortage of over 3,000 nursing personnel. What we have been seeing, especially during the pandemic and since the pandemic, is that we are actually going in the opposite direction. We are actually reducing our numbers of nursing personnel as we speak, as more and more nurses leave the profession. Despite we are training, we have 3 registered and accredited nursing schools and 1 that is not registered and accredited as we speak. So really and truly, there were 4 nursing schools as we speak. And even though hundreds of nursing personnel, which are being absorbed by the RHAs, will continue to have a numbers. We are not addressing that shortfall. And this really has to do with the lack of the government to implement measures to retain nursing personnel. It's one thing to hire, continuously hire, but retaining those that you are hiring. In fact, hire, as persons would know, you would have a number of nursing agencies recruiting nursing personnel from abroad, Canada, USA, Dubai, all over the world want our nursing personnel, primarily because we are quite good and also because English is our language. So the Caribbean is a real pooling ground for those recruiters. And they knew to pull persons long ago, they used to wait until you were about 2, 3 years with experience. Now they are pulling you straight out of school. And the government's nursing personnel, just like the rest of the public service, still remain on 2013 rates in 2023. So all of those factors contribute, and then two, there's a lack of upward mobility for nursing personnel. There are not a number of areas. There's not continuing education. You have to jump through hurdles to continue your education. Imagine in a profession where should be mandatory for you to continue your education to keep up to date with the best in healthcare. They actually preventing you, holding you back from continuing your education. So there's a number of factors. In addition to nursing personnel were temporarily employed, so you didn't have that no permanency within nursing. Still, as we speak in Tobago, they refuse to make nursing personnel permanent as we speak, even though we have been successful as an association in getting nurses in Trinidad permanently employed. The exercise has started, and a number of nurses are being made permanently employed in Southwest and NCRHA, what have you. Tobago still adverse to making nursing personnel permanent, so they continue in these short tracks. So there's a number of rules, and what does this spell to our patients? This means that one, you will end up not having the quality of care. Your care will not be safe, it will not be effective, it not will be efficient, it will not be patient-centered to ensure your clinical outcomes improve. So you have poorer clinical, you have longer hospital stays. You'll end up with a higher hospital overall bill because now more consumables has to be directed to you. You'll end up seeing patient falls. You'll end up seeing patients coming out with bed sores because you just don't have the manpower to be turning patients every 2 hours. Your nutrition will fall because you don't have enough patients to sit for about half an hour to feed a patient. Sometimes it takes that long for patients with nasogastric issues. So this and ultimately a death rate, and that really be retarded, could be reversed if you have better patient to staff ratio. The evidence is clear. If you have if you have that quota of one nurse to about 4 or 5 patients, your chances of recovery in as short as possible time, the turnaround time between when you enter hospital to when you leave is decreased. The ability for you to recover quickly is improved. So the evidence is clear, and we cannot understand why a government have no issue with spending billions of dollars, both borrowing and spending, that they would be willing to build more and more secondary health facilities, second hospitals, and these permanent structures, and just don't have the staff to put in these permanent structures.
Mr.
So it's a
Stewart,
real, yeah.
yeah, we thank you so much this morning. We feel your passion and we understand the grievance, and we look forward to the updates on this as you progress in this plight for more nurses in our healthcare facilities. Ladies and gentlemen, we were speaking with Mr. Idi Stuart, and he is the president of Trinidad and Tobago Registered Nurses Association. Thank you, Mr. Stuart, for joining us. Ladies and gentlemen, of course, we're going to go to a break this morning. But of course, before we go, we're asking you to do what? Share the live, share the live, share the live.